Okay, hi everyone. I'm Dinh. I'm going to talk about the 2025 medical coverage benefit. It's more about the refreshings and just a little bit of updates. So I'm going to talk about the Medicare first. So it's around this time, it's open enrollment. So usually for Medicare's, open enrollments happen in October 15 to December 7. And during this time, folks who have Medicare benefit, they can change their benefit, like, they can change their Part D benefit, or if those who enroll into Medicare Advantage, which also called Part C, they can also change or switch, to a different Part C, or if they don't want their current Medicare Advantage plan, they can always drop out. And and then especially for folks who only have Medicare benefit, then this is a pretty critical period open enrollment where you can make change for your own benefit the following years. And then also effective at January 2025. For those who are eligible for Medicare Part A, the DXCF, which is the Department of Healthcare Services, will automatically enroll individual with full scope Medi-Cal into Medicare Part A, meaning that you don't have to do it, but then more detail to comes. Since there currently still being discussed about how the process will go. So typically, if you're familiar with Medi-Cal, let's say if you transitioning to 65 years old, you usually will receive some sort of notice asking you to apply for Medicare, whether or not you're eligible or not, but you still have to comply with the process of going to Social Security Administration to apply for Medicare, and then bring back the proof to Social Service Agency and let them know that you have already complied. Again, whether or not you're eligible, but you still have to comply with that process. However, so this is something new. So by January 2025, if you are eligible for Part A, the DXCI will automatically enroll you into Part A without you having to go to Social Security's administration and having to apply for that. And again, notice that this is only for Part A. It's not, they do not, they didn't tell anything about Part B. So, for Part B, if you're still interested of getting Part B, you still have to apply it on your own in Social Security Administrations. And notice again that, this is only the Part A's buy-in. Then also for UnitedHealthCare's, from what we know, UnitedHealthCare will no longer offer Medicare Advantage plan, but also known as Part C, effective next year. So for folks who currently have UnitedHealthCare's, who currently join Medicare Advantage and select UnitedHealthCare's, you may have already received some sort of notice from them telling you that, they will no longer offer the plans, and if you wanted to receive similar benefit, you may want to consider a different health plan. A different health plan where it's offered Medicare Advantage with similar benefit. But of course, if you don't want it to join any Medicare Advantage, you can stay Medicare fee for service. That's fine. There's no obligation that you have to join to a different health plan, to a different Medicare Advantage health plan now that United Healthcare is no longer offer it. However, though, if you do decide of not joining a similar Medicare Advantage health plan, make sure that you enroll into Part D. So the next one I'm going to talk about will be the Medi-Cal. So this is more like reminders. So as part of the Medi-Cal's, responsibilities is that there's this annual redeterminations for all the Medi-Cal beneficiary. However, during the pandemic, this process has been paused the whole entire time during the pandemics because, oh, I'm sorry. Yeah, because the government didn't want to terminate medical benefit for folks during the critical time, right? However, there's a couple updates is that the the update process of them doing the annual determination right now is that they will first look into yours household incomes, household compositions, and all the pertinent information, whether or not if they can verify the information. So if they successfully verify your information during the process, they will automatically extend your cover for another years, meaning you will not receive any paperwork, any redetermination packet in the mail where you have to fill it in and return it back. However, if they're not able to verify your information, then of course they're still gonna mail you the redetermination packet where you're gonna have to, clarify or verify the information that is weren't able to verify from their end. And usually, once you receive the notice, the redetermination notice, it will be best to fill it out and return it back to them as soon as you receive it, because there's also a times limit. Usually within a month, there's usually a timestamp or the due date on the redetermination packet. So pay attention to the day. If you cannot complete it right away, make sure that you complete and return this by the due date to avoid any termination of Medi-Cal benefit. And then, a couple notices here are, if you move or if you have any change of address or, personal information, household composition, we do advise you to report it to the Medi-Cal or to social service agency immediately, just to avoid any delay in mails or delay in, notice or anything like that, especially with the address. So just like what I mentioned earlier, there's a chance where your benefit get automatically extend for another years, right? However, if you did not report the change of address to them and they did indeed mail it out to you, but you have not received it, because they never have the more updated of your address, then you may jeopardize of losing your medical coverage, because you have wouldn't for you not receiving the package, obviously you would not be able to return the information back to them by the due date. Right, so if they did not receive anything back from you by the due date, then they will terminate your medical benefit. So what happened if you actually didn't, I mean, if you did report of the change and everything, but you still have not, I mean, typically you comply to every single thing, but your benefits still get terminated for whatever reason, right? Because um that mail and delay, loss of mail, all of these factors, uh take into the considerations. So let's say if you receive the notice from the social service agency telling you that your Medi-Cal will be terminated by the end of October, so October 31st, let's say, and then, what can you do? First, don't panic about it, because you're gonna have 90 days to rescind your Medi-Cal benefit if you still found eligible for Medi-Cal. So let's say if you receive the notice saying that your Medi-Cal gonna terminate it by the end of October 31st. So what happens is that, so because you have 90 days, so typically it's all the way until January of next year, you have all of this time to provide proof of your household composition, your income, or whatever's the reason that they terminated your medical benefit. So you do have you do have all this time to provide all of that information to them, just so that they can rescind your medical benefit if you still found eligible for it. But let's say, if you is not eligible for Medi-Cal because of you exceed the income limit, what can you do? Of course, there's is the Cover California platform where you can, utilize the platform and enroll into different health plan with the government subsidize. So in Cover California, there's a different, there's the different health plans that's offers. For example, Kaiser, Blue Cross, Blue Shield, and some other health plan too. And then also, this is also the open enrollment for them for new application, meaning, for folks who never have enrolled into any health plan via Cover California, then you can take advantage of this time, November 1st, 2024 until January 31st, 2025, which is next year, to apply for health plan through Cover California, what the government subsidize. And for those who already have health plan through Cover California at this time, then this is also a renewal period where you wanted to look at your look at your current health plan to see if you still wanted to keep it, and look at the premium and thing like that, to see if there's any change for next year, and if you indeed did not like the health plan that you currently have, this is the time and the only time, except for, beside the special enrollment, then this is the time where you can change and, make update to yours, to the health plan through Cover California. And typically, the reason why I put until December 31st, 2024, well, because if you do it before December 31st, 2024, yours, you can have a continuance of the health plan benefit, meaning, your health plan will take effect by January 2025 next year. However, if you for whatever reason, if you miss this period, you forgot to renew, then typically you still have until January 31st, 2025 to do the updates on the renewal. However, the health plan would not start until February of 2025, meaning you're going to have a gap in coverage for January 2025. And then the others updates for Cover California is they effective November 1st of this year already. They will grant government subsidized pretty much a premium assistance to the population, to this population, which what we call DACA, which is for deferred action for child of arrival recipient. So typically, this population is the population where where they turn 16 by the time they come over to United States around June 15, 2012. So meaning all the way up until now, they probably have already turned 30. I mean, they must be 15 to 30 years old. So this population is typically 15 to 30 years old because if you do the math, by 2012, they need to be at the 16 and under, right? In order for them to be, to be categorized into the populations. So this population by November 1st of this year, if they have high incomes or if they're not eligible for Medi-Cals, then they can purchase health insurance through Cover California with premium assistance. However, because of the suspension, then it's kind of granted everybody who have this DACA kind of status. So those though with DACA status and do not, and select not to have health insurance, then they will be subject to state's penalty by the end of the years. And for Asian Health Services, as of right now, we only contract with Blue Shields of California through Cover California. So for folks who currently are, Asian Health patient and wanted to continue receive care from your primary care providers, and where your Medi-Cal where you're no longer eligible for Medi-Cal because of incomes. And if you decide to get Cover California, and if you wanted to stay with us, then the only health plan that you can select will be Blue Shield at this point. And the next one, I'm going to talk about the Calfresh benefit. So this is not going to be a details on, a full blooms on, the Calfresh benefit, but rather it's just kind of like a refreshing, and, it's just a really preliminaries of the process. So what Calfresh process, typically pretty simple. Once you apply, what you need when you apply is a copy of your ID or and a proof of the immigration status. It's either you either have to be a citizenship or a legal permanent residence here. So currently, undocumented folks are not eligible for CalFRED benefit at the moment. And then, of course, if you have any incomes, you wanted to provide proof of incomes. And for CalFRED specifically, they also consider your expense. However, not all your expense will be allowed. There's only certain kind of expense, such as, your rent, your mortgage, anything that related to your mortgage, and all your utility expense are allowed. And then also, for folks who have a pretty high medical expenses on the monthly basis, you can also submit that as well. And those are also allowed and will be considered. Notice that it doesn't say about proof of expense. So meaning, I mean, if you have proof of expense, then of course, it's provided to them. But a lot of time, we may not have a proof of the expense. However, we actually paying for it. If you do actually paying for the expense, it's just like the one that I list earlier. Do do I would say do tell them about that, and then they will do their verifications and see if they wanted you to provide proof. And the worst scenario is that if they ask for proof and then you didn't have it, then they just remove that from the expense part. So there's really no harm of um, reporting the expense that you're actually paying, but you have no proof of it. And then, so that's that application process. And then, when you apply, typically, you get the call for a phone, either phone interview or in-person interview, however that you want. And then it typically will approve within 30 days. And then, sometimes I've seen application get approved within a week or so. So, the process is pretty fast for CalFresh. And when you get approved, you will be mailed the EBT card where it's low with your benefit, where you can purchase your groceries, um, at all the participate stores. And then, so that is just the application process. However, in order to continue your benefit, there are a couple of things that you're going to have to continuing doing. So every 6 months, you receive the semi-annual report, which also sort for SAR 7. Um, so it's typically it's a 2 pages of report where you just report your incomes and your expense or anything different than what it was when you apply. And then every year you're going to receive the redeterminations. So that is the two report or report that you're going to have to comply in order for you to continue receiving the benefit. Um, so So for all the program that I mentioned earlier, for Medicare, Medi-Cal, Cover California, and Calfresh, we can also assist. We can assist our member services, and Patient Navigator can assist with the process. And specifically for our member services department, our hours Monday to Friday from 9 to 5. We close from 12 to 1. And our number is 510-986-6880. If you have any question, concern for any of the program that I mentioned earlier, you can always give us a call, and we'll be happy to get you more detail of it.